It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
Heart failure is a chronic disease that affects millions of people, but there are ways to manage it. I'm Lauren Scott, your host for Kansas City Spotlight, and I sat down with Dr. Michael Farrar at North Kansas City Hospital to learn more. What exactly is heart failure?
So heart failure is a clinical syndrome where there's fluid overload that builds up in the body because the heart is not functioning normally. So you get fluid in the lungs and people get short of breath. You get fluid in the legs, they get edema. It can be related to the heart not pumping as strongly as it should. The heart's weak, or it may not be relaxing normally. It may be too stiff.
Okay, so how do we go about treating this?
Well, the first thing we do is we restrict people's dietary sodium because sodium makes you retain a fluid, and that's a really important part of the treatment. Then we have medications that we give, diuretics to get rid of the fluid, and then we have a whole host of different medications, several classes of medications that improve the pumping function of the heart and the relaxation of the heart and improve the survival and decrease the risk of hospitalization.
What is the prognosis when someone receives a diagnosis like this?
Well, depending on the underlying heart problem that's present, it varies to some degree, but the average survival is about 4.3 years after the diagnosis of heart failure, so it's a pretty severe disease. I mean, 2/3 of the patients are dead at 5 years. If we put patients on complete treatments of all the medications, the survival is more than doubled up to about 9 years, with about 75% of the patients alive at the end of 5 years.
So how can North Kansas City Hospital's Heart Clinic help with this?
Well, the Heart Care Clinic is an invaluable tool because they can see the patient quickly and promptly. We staff it with nurse practitioners that work with us. They adjust the medications, they educate the patients, and it's been highly effective in keeping people out of the hospital, which is good for us and good for them.
So what is some things that we can all do right now that can impact our heart health?
Well, the two most important things, number one is to exercise regularly, and the preventative cardiologists say just walking. If you can walk every day, it makes a huge difference. The other thing is cut out your salt intake, try to restrict the salt, but basically a Mediterranean style diet, which the most important part of is not eating any processed foods. If we didn't eat processed foods, we'd all be healthier.
Okay, well, a lot of great information. If people want to learn more, where can they go?
They can go to a website that it's called youdeservealeader.com, and it will have all this information on it.
All right, well, thank you so much for being here with us today.
Thank you, I appreciate it.
This Kansas City Spotlight has been paid for by North Kansas City Hospital and Meritas Health. For more information, visit youdeservealeader.com.